a scapular mobilization. So I'm going to take a knife edge, I'm going to hook it around her scap, okay? But now I need to passively contract her. So I need to put her in the most relaxed state I can. So you don't want her to do anything. So I'm going to scoop underneath her shoulder. You just relax for me. I can already feel she's really, really tight right now. Okay? So she's going to guard a little bit on me. She's already guarding. Breathe and relax. If she contracts, it forces me out of the position. Okay? So you know when your patient is not relaxed because you can't get where you need to get. Your goal is to use your other hand, keep them as supported as possible. Get your knife edge contact underneath there. So you're getting as much subscap as you can. You're also stripping out the rhomboids. I'm locked in here using my body weight. Good.
We didn't do anything like that, but I mean, like moving it. We did putting it under the shoulder.
No, we did where you grab it like that and you grab the shoulder and then you move it with the shoulder.
Good.
Yeah.
But he's doing it vigorously. Candy didn't do it like vigorously.
If they're relaxed, you can almost get, I've had clients that have enough mobility of their shoulder that I can almost get halfway under their scap. It's creepy. Okay? But if your shoulder's locked up or you're really, really tight muscularly, okay, it's difficult to do. So people are going to be, especially if you're tight, you're going to be guarded. So as soon as you touch her here, I feel her guard. Okay? Whether she does it consciously or unconsciously, she guards. So as soon as I start to push in there, until I start to get kind of a rhythmic pattern going, she's tight. She's hard to get in. Okay? But once you start to kind of add that rhythmic movement, as long as she's not helping you do the pattern, then you'll start to get in deeper and deeper. Okay? Okay? And then you can strip out the rhomboids. So I'm just going to take from her spinous processes where they attach. I'm going to get my contact and I'm going to rake them away. Okay? I'm going to hook and rake them away. And I'm just going to draw. I'm going to use my whole body, just literally draw her away. And what way do those move? They do this, right? So how are they attached? Think about your anatomy. This is where, like I said, day one, you guys, I don't know about other massage therapy programs. I know about mine, and I didn't have access to cadavers. I did from my bachelor's in corporate fitness, but that was how I had that access. The other people that were in my massage class had never seen a cadaver. You guys have a huge upper hand because you're at a medical college with cadavers. You get to see this stuff live with your anatomy. It's not just a 6-week, certification course. It's a long drawn out. So imagine your anatomy. How are the rhomboids? What direction are the fibers? Work with the fibers. Pull them down and away. Okay? Upper traps, lower traps, how do they work in there? Okay? So they're all kind of, there's this big kite, right? Your lats, when you get up underneath the lats or the serratus. Imagine those finger-like progressions because you can basically wrap around, just like the serratus, on the underside of the ribs. Okay? So when you start digging into people, did you guys do serratus stuff?
Yeah,
like
serratus, pec minor.
Raking.
Yeah, raking them is pretty much.
Did you have them sideline?
Yeah.
Okay. So they taught you about that, keeping them sideline.
Yeah, we don't go that deep, because the serratus is a little bit interior.
Yeah, it goes further in, and we just pretty much did right
we
through
just
here.
right here.
And then through the back.
You guys mostly just got obliques. So if you go side, how tender are you? You very ticklish?
No.
Okay. I'm going to have you lay on your side facing them. Bring your knees up just a little bit, like fetal position. Good. So here's where you, okay, obviously for women, in this perspective, you want to make sure that as their sideline, breast tissue falls away from them. For you guys, you just have to make, you guys already know that. That's the good news about women versus a male massage therapist. Okay? We don't think about that until it's run into a problem. Okay? So I'm going to have her relax her arm. Okay? So now all the danger zones fall away because I'm going to hook around her lat. I'm going to find her ribs. She's going to tell you by her face, okay, that this is not going to be very much fun. All right? Now, if you want to make it more comfortable for your patient, broader contact, softer fingers. You want it worse? Point the contact. Okay? Have a smaller contact. Broad contact for stuff like this. You want to wrap your hand against her ribs. I'm literally trying to pull it against her ribs, trying to fold her arm over my hand so I find my contact first so that she's as relaxed as possible. If I have her abducted, her tissue is going to be really, really tight. Okay? So now I want to try to go in along the ribs. There's your pec minor. Feel that? Feel that cord? Okay, pec minor comes down off the coracoid process onto ribs 2, 3, 4-ish. Okay, right there, and you can feel that rope. Now if I go down, now if I go down further, okay, getting right through here, now I can get more into, there's the bottom of your pec minor. Now I can get into the rib. I feel the rib head more. I feel the curvature of the rib, that angle. And now I'm getting more into serratus. Okay? But you have to be really careful, and your sheet will tell you that's very tender. Okay? And you can feel yourself rake over that pec minor for somebody that you can get into the pec minor or if there's really hypertrophy. Okay? So then I would work on that first to get the tissue. Then I'd have her lay on her back. And I would stretch pec minor. So I take it up and out. Okay? If she doesn't feel that, I can bridge it, so I can put a towel under here, and I can make it more impressive. Okay? So you can make it where she can take her off the table further. All right? You just want to be cautious with external rotation and extension is where the shoulder can dislocate. Okay? That's why hockey players that go up against the boards, or people that fall off a horse or whatever, when they fall out with an outstretched arm, it's usually an external rotation and extension overhead, and that's where it dislocates. Because that's where the humerus doesn't go. Right? And then stretches. The basic primary stretches that I told you guys, if you don't stretch your patients, you're not helping them. It wouldn't be fair if I didn't show you how